and what all to expect during a fellowship. So for our first talk is Crafting Your Fellowship Journey, How to Choose the Right phaco Fellowships by Dr. Tresa Antony. She is currently a consultant phaco surgeon working at Amita Eye Care, Tiruvalla. Welcome. And you can start.
Thank you, Dr. Raki. Over the next few minutes, I'll be highlighting certain crucial factors that will definitely help in the roadmap of a successful phaco surgeon. So, this is what happens at the end of my residency, your residency, and everyone's residency. You are the jack of all trades, but the master of none. And this makes the fellowship a necessity. And these are the struggles we go through post residency. Every institute now requires a ophthalmologist with a fellowship. And if you apply to a training center, there will be a long waiting list. And for females, there will be a lot of pressure from the family to settle down with marriage and children. And this is a time you will be struggling with work life balance and financial pressure. So, with that in mind, at the end of 5.5 years of MBBS and 3 years of post graduation, you all will be standing at this crossroads thinking, should I go for a fellowship again? Before choosing any fellowship, weigh the pros and cons of each subspecialty. Find out what is your passion and what kind of job gives you the most satisfaction, because this is what you will be going to do in the next 30 years of your career. And always find out the job requirements in the area where you want to settle down. And always ask yourself that after undergoing this concerned fellowship, can I become a competent practitioner in that area? Choosing cataract as subspecialty is really rewarding for a number of reasons. Obviously, we have a wider pool of patients and it's a gratifying specialty because it gives 6/6 vision to the patient the very next day of post-op, and the smiling face of patient is highly rewarding for the surgeon. There are unlimited job opportunities with a good pay right from the beginning, and a lot of vacancies are open in both rural and metro cities compared to other specialty. So, why there is need for phaco training? Phaco emulsification, which has become the gold standard of cataract surgery, and surgical proficiency in phaco emulsification is a most mandatory core competency for the modern cataract surgeon now. And now we are moving to the era of refractive surgery. And in the present scenario, there are a lot of expectation from the patient, like we need a eagle vision immediately after the surgery. But if we look into the surgical training of the residents in India, it's not keeping in pace with this situation. So it's always important to understand the ground realities from a resident perspective. Residents most of the time are exposed to limited surgical volume and they hardly get their turn once in a week and never get to do the wet labs. So the high stress environment and all the difference in this curriculum make residency a bad destination for making a proficient in-house cataract surgeon. And when you ask for phaco exposure during residency, this is what happens. An anonymous online survey was conducted among the ophthalmology residents of India, and the result from the survey showed that majority of the residents are getting good number of SICS, but when it comes to phaco emulsification, the exposure is very limited. And if we look what is happening in Western countries, the data from the European board showed that the self-confidence level to perform a case post-residency was rated only 4.1. And all this data shows the need for an appropriate training. And during the transition phase, that is when we are just into the fellowship, what we all need to change is the mindset before the actual learning. So most of us in the beginning stage has a common question in mind. Are the surgeon born great? And we often hear from our colleagues that this surgeon has got great hands. Is this really true? These kinds of thoughts are quite disheartening and for a lot of people, especially for those who have lack of self-belief. Surgeon born great is a myth. Surgeons are actually made with structured and appropriate training. This clarity of thought is required before joining any training program. And where to choose the fellowship? Obviously, everyone will be looking for a place with good numbers, good pay, and comfort zone. But in reality, this triad doesn't exist together. From a surgeon's perspective, what is more important is getting good surgical number. So you have to sacrifice the other part to get a good surgical number. The next question, whether to go for a short term or long term. It all depends upon how you were trained during your residency. Short term fellowship will be beneficial for those who are well versed with the SICS skills, like who are good in capsulorhexis, and obviously it opened windows to other subspecialty. Long term will be beneficial for those who had inadequate exposure to SICS and who needs cataract subspecialty as a career, and you will get a lot of opportunities to manage the complication. So, be wise while choosing an institute. See for the faculty available for training, because Arjuna was defined by Dronacharya. And choose an institute with a good infrastructure. It's always better to go for observership and visit their OT just before joining the institute. Ensure that they have a well structured academic program, and always talk to the ex fellows and inquire about the hands on experience they had. Make sure the institute has a good wet lab. Go to the institute where they teaches you even the minutest steps sequentially and systematically. That is from basics to SICS to phaco and to manage the complex cases. Always prefer an institute with research and publication opportunities, and an institute with posterior backup segment is always preferable. So the list of institute is endless. You can avail the data from AOS website. YOC help desk is really helpful. So with a right mindset and with a structured training, you all can become a competent phaco surgeon. Thank you.
Thank you, Dr. Ann. That was a wonderful talk with great insights.